Most of us know how to provide first aid for minor cuts and scrapes. But do you know what to do for an injury that causes much more serious bleeding? Bleeding emergencies can include injuries such as severe loss of blood, impaled objects, or internal bleeding. All of these are serious and life-threatening injuries, so it's important to call for emergency medical care and provide first aid to try to slow the loss of blood or otherwise help the person. The first aid you'll provide will be different depending on the injury. Emergencies involving severe bleeding can happen anywhere, even at school. In these situations, it is critical to provide the proper first aid until medical help arrives. Performing a few simple steps in response to severe bleeding can help save the injured person's life. By the end of this course, you'll be able to explain the importance of calling for emergency medical care if someone is bleeding severely. Explain the importance of protecting yourself before you provide first aid to a person who's bleeding severely. List the steps for providing first aid for severe bleeding. And list the steps for special first aid, such as impaling and internal bleeding. Later, you'll have a chance to test what you've learned with a quiz. So if you're ready, let's begin. Anytime someone is bleeding seriously or losing a lot of blood, it's a medical emergency and you should immediately call for medical assistance. In situations where there is more than one person available to help, have one person call for emergency medical care while the other provides first aid. If you're alone, however, summon emergency medical care as quickly as possible and then help the person. In some cases, you may be able to do both at the same time by using a cell phone. In many cases, when you provide first aid, not only do you have to help the person who's sick or injured, but you've got to protect yourself as well. That's especially true when you're helping a person who's bleeding. A person's blood may carry diseases that can make you sick and even lead to death, such as HIV, AIDS, or hepatitis. That's why it's very important that you take measures to protect yourself from the person's blood. These measures include wearing appropriate personal protective equipment, also called PPE, such as medical gloves, eye or face protection, and protective clothing so blood or splatter doesn't get in your eyes, up your nose, or on your skin. Your school may have a first aid kit that includes this PPE. Ask your administrators about this, and always remember to use this kind of protection so you can protect yourself while helping others. If a person is bleeding severely, call for emergency medical care and then provide first aid using the following steps. Step 1. Talk to the person to help them remain calm. Step 2. Put on your PPE. Step 3. Have the person lie down and help them do so if necessary. Step 4. If possible, elevate the bleeding wound so it is above the level of the person's heart. Step 5. Use a sterile bandage or gauze pad to apply direct pressure to the wound. If you can't find a bandage, use a clean towel or some clean clothes. Keep applying pressure to the wound until the blood stops flowing or until emergency help arrives. Step 6. If blood seeps through the first layer of bandages, add another layer. Do not remove the first layer. Finally, Step 7. Provide first aid for shock, which is described next. People who are experiencing a bleeding emergency often go into shock. Here's how to provide first aid for shock. Step 1. Lie the person down on their back. Step 2. Elevate the person's feet above their head. If an injury makes this uncomfortable, leave the legs flat. Step 3. Cover the victim with a blanket or coat and loosen any tight clothing. Step 4. Keep the victim warm and comfortable. Step 5. Do not give the victim anything to drink. Step 6. If the victim is bleeding from the mouth or vomits, turn their head to the side so they won't choke. And finally, Step 7. Treat any other injuries. In some cases, if bleeding is very severe, it can help to apply pressure to one of several pressure points on the body. Applying pressure reduces the amount of blood that flows to the wounded area. This, in turn, reduces the amount of blood that the injured person will lose from the wound. Some pressure points on the body include on the upper arm between the shoulder and elbow, along the bikini line near the groin, and on the backside of the knee. Always apply pressure at a point between the heart and the wound, along the path that the blood travels. For example, if the person is bleeding in the lower arm, the pressure point on the upper part of the same arm is the right one to use. And if the person is bleeding from the lower leg, applying pressure to the pressure point behind the knee and even by the groin may help. A tourniquet is something, like a piece of cloth or a belt, that is tied around a person's extremity, such as an arm, finger, or leg, to reduce the amount of blood flowing to the wound. Using a tourniquet on a person can cause the person to lose the affected body part. As a result, you should only use a tourniquet as a last resort, when you can't stop the bleeding any other way and the person's life is in danger. Here's how to apply a tourniquet if necessary. Step 1. Place the tourniquet at a spot that's between the wound and the person's heart, as close to the wound as possible, but not on the wound. Step 2. Use something like a pencil or stick to twist in order to tighten the tourniquet. Step 3. Tighten the tourniquet just until the bleeding stops. And finally, Step 4. Be sure to show the emergency medical care team where you applied the tourniquet when they arrive. An object, such as a knife, nail, or piece of glass or metal, can be impaled into a person's body or extremity. Here's how to provide first aid to a person with an impaled object. Step 1. Talk to the person to help them remain calm. Step 2. Put on your PPE. Step 3. Leave the object in place. Do not try to remove it or move it. Step 4. Control bleeding with pressure to the wound area. Never apply direct pressure to the wound or the object. Step 5. Stabilize the protruding object with towels or some other material. Don't tape the towel to the protruding object. And finally, Step 6. Treat the person for shock. Injuries, such as impaled objects, can cause bleeding inside the person's body in addition to the bleeding coming from the wound. Sometimes, a person can be bleeding inside their body even though you can't actually see the wound or even the blood. This could be from something hitting the person's body very hard and not breaking the skin. Bleeding inside the body is known as internal bleeding. Even though the bleeding is internal, this is still a very dangerous or even fatal condition. How do you know if someone is bleeding internally? Because you cannot see internal bleeding, you should be familiar with the symptoms. Symptoms of internal bleeding can include pain in the affected area, blood exiting from a body cavity, such as the mouth, ears, nose, or rectum, bruising of the skin, skin that is pale, clammy, and cool, extreme sweating, rapid, shallow breathing, dull eyes and enlarged pupils, thirst, weak and rapid pulse, and nausea and vomiting. Because internal bleeding can quickly become a life or death situation, immediately summon emergency medical care if you suspect this condition. People who are bleeding internally often go into shock, so first aid for internal bleeding is the same as first aid for treating shock. As described earlier, here are the steps to treat shock. Step 1. Lie the person down on their back. Step 2. Elevate the person's feet above their head. If an injury makes this uncomfortable, leave the legs flat. Step 3. Cover the victim with a blanket or coat and loosen any tight clothing. Step 4. Keep the victim warm and comfortable. Step 5. Do not give the victim anything to drink. Step 6. If the victim is bleeding from the mouth or vomits, turn their head to the side so they won't choke. And finally, Step 7. Treat any other injuries. In summary, bleeding emergencies can happen at home or at school, so it's important to be prepared. You've learned the importance of calling for emergency medical care as quickly as possible. You've also learned the importance of protecting yourself from possible diseases in the person's blood by wearing the appropriate PPE, such as medical gloves, glasses, or face masks. Finally, you've learned how to recognize and provide first aid to a person with severe bleeding, as well as special first aid for people with severe bleeding, impaled objects, and internal bleeding. All of these are very serious injuries. Knowing how to provide first aid to a person in these situations can be the difference between life and death. After taking this course, you should be able to explain the importance of calling for emergency medical care if someone is bleeding severely. Explain the importance of protecting yourself before you provide first aid to a person who's bleeding severely. List the steps for providing first aid for severe bleeding. And list the steps for special first aid, such as impaling and internal bleeding. Review these points and repeat this course if needed.